Hello and welcome back. Once again, I'm your teacher Ashok Rajguru, and in this video we shall take up a case where Aconite had proved very useful. This case is taken from a book called The Elements of Homeopathy by Dr. P. Shankaran. Dr. P. Shankaran is the father of another famous homeopath, one of our contemporaries, Rajan Shankaran. Dr. P. Shankaran, the father of Rajan Shankaran, was born in 1922 and passed away in 1979. He used to practice in Bombay, and he had studied homeopathy under various masters, which included many teachers in UK. This particular case concerns a woman, and Dr. P. Shankaran in his book tells us that one night in Bombay, I was called upon to treat an elderly lady whom he calls as Mrs. X, aged about 60 years of age. She had become extremely restless. I found her pacing about to and fro agitatedly, and she had been doing this for nearly 12 hours. So obviously this lady is in a state of panic, distress, what we can call as a state of fight or flight, tremendous stress or panic. Continuing further, Dr. Shankaran tells us that it appears that 3 days back her daughter had left Madras for Delhi unescorted. After the train had left Madras bound for Delhi, a telegram had been sent from Madras to the relatives in Delhi so that they could receive her at the station. And what happened was that the relatives in Delhi duly went to the station to receive her, but she was not found in the train in which she should have arrived. Obviously, that's a state of panic because here was a young lady traveling unescorted all the way from Madras to Delhi. That's virtually a 2-hour journey, a 2-day journey. And in those days, when Dr. Shankaran was practicing, there were no mobile phones, and even landlines were possessed by only a few people. Now we are told that naturally the relatives grew very anxious and made a trunk call to Madras. A trunk call was a kind of a long distance phone which had to be booked in advance, and very often the reception quality was also very poor. This only made the relatives at Madras also anxious, as they in turn made a call to Bombay to see if by chance the young lady had reached Bombay. That's where her mother was staying. And this is a case that Dr. Shankaran is telling us was happening in Mumbai, or Bombay as it was known then. It turned out later that she had, on an impulse, got down at Nagpur on the insistence of some friend. So the young lady got off halfway. It's a day's journey from Madras, and obviously she has not informed her relatives in Madras or her mother in Bombay, and nor was any information sent to the relatives who were supposed to receive her in Delhi. So when Mrs. X came to know that her daughter had left Madras but had not reached Delhi, and so she was missing, that's what she surmised, she was naturally very worried and was in a virtual state of panic. She became extremely restless and agitated and was terrified. She was pacing to and fro, wringing her hands and moaning. And she was saying, "Take me to Delhi or to Madras. Take me somewhere." So you can see from her words that she was indeed in a terrible state of panic. Dr. Shankaran tells us that his son called the doctor, that's Dr. Shankaran, and the son said that he wanted him to give her a sleeping dose. As we can see, for the past 12 hours she has been pacing up and down, and he wanted his mother to take some rest so that she could calm her nerves. I agreed to do so, And considering the causative factor was fright and anxiety, and the result extreme restlessness with anguish. So with this, he gave her a dose of, I'm sure you must have guessed it, he gave her a dose of Aconite in a 1 m potency, in a very high potency, considering the fact that the causative factor was mental shock. Next day, her son turned up to thank me for the sleeping dose because she had slept well and was back to normal. So that is really what we can call as the magic of the minimum dose, just 1 dose of Aconite. And you can see that the prescription was based on just one thing, the causative factor. And secondly, it was based on the very clear symptomatology that matched Aconite. The fear, the panic, and her reaction of pacing up and down in the room and being desperate. So Aconite covers all these symptoms. I will just do a quick recap of some of the symptoms of Aconite that have been shown in provings, on the basis of which you can choose this medicine in similar situations. Aconite has got nightly raging delirium. A person is virtually in a state of delirium. Transient frenzy, excessive restlessness. The person may appear to be very impatient and have very hurried speech. There is great anxiety and apprehension. Also, it could be a state where a person is showing great timidity after severe fright. That's a typical response of a flight, in a fight or flight situation. And we also have fear of the consequences of fright. This lady was not just afraid that her poor girl had gone missing. I'm sure what was going on in her mind was all the terrible things that you can conjure up in your mind could happen to a young woman who has gone missing on a train with no information to any of the relatives in Delhi, Madras, or herself in Bombay. So that brings us to the end of this video. Thank you very much for your attention, and I'm sure this will help you understand Aconite and see how this prescription fitted so well. Thank you very much, and see you once again in the next video. Until then, bye bye.